Hello and welcome to the NGO Whisperer show. My name is Dr. Carolyne Opinde. I am the founder of the NGO Whisperer and the convener of the NGO Whisperer Masterclass, which is the official sponsors of the NGO Whisperer show. Joining us today for part 2 of addiction prevention, rehabilitation, and wellness is Kibe Edwin Gitau from Nairobi, Kenya. He is the founder of Uhai Center. Kibe, welcome to the show.
Thank you very much, Dr. Carolyne Opinde. I feel honored to be with you this session. It is a great honor. I feel privileged. And in fact, it makes me feel good. It is very motivating because of the things that you're doing, especially for the non-profit touching on humanitarian activities. Thank you, Dr.
Speaking of reintegration, what does the process look like? And I would like us to look at someone who has been addicted and is at the highest level of addiction and maybe lost friends, lost family members, or lost a job, and now needs to be reintegrated to the point that they probably need to get a new job if they were laid off.
Reintegration can only happen if rehabilitation has taken place. So first and foremost, you have to treat this person. You take him through the therapies. You take him through the physiotherapy, the psychotherapy, the psychiatric treatment, and all that. And eventually to the cognitive ability. He comes to his senses and he realizes that I have messed my life and I'm willing to change. And this is where we work through the counseling, through the psychotherapy. We bring the reasoning, the cognitive ability back to the person he comes to. We teach him social skills. We teach him a new methods, new life skills that he never had there before. As we are doing this is the individual that we are working with. But remember something, Dr. Opinde and our viewers, that we are rehabilitating this individual. But it's quite unfortunate that the environment that he came from remains constant. It is one and the same. The parents remains the same. The peers he was working out or he was hanging out with remain the same. So we have to capacity build this individual such that he has the resistance skills, he has the refusal skills, and at the same time, we get reintegrated into the community and in the family. So what do we do? When this person is in the treatment, after he gains his cognitive, we invite the family members. We take them through a therapy. We call it a family therapy, whereby we prepare the family way before he is discharged. We prepare the family that this is a different Edwin. This is not the Edwin who was drinking throughout the day. He is a different man who is different and who has focus, who has objectives in his life. We have prepared him such that the significant people who are the parents, the significant people who are the brothers, the significant person who can be the spouse, gets to know that this person needs full support. And the first and the foundation support, the primary support can come only from the people around him. And we teach them that addiction is a disease, just like any other disease, Dr. Opinde, where you have diagnosis, you have treatment, you have healing, you can manage your problem of alcohol or drugs. So we prepare them so that they don't stigmatize, so that they don't talk negative, so that they stop name calling because you're called, you are a drunkard, you are careless with your life. We prepare them so that they embrace the new beginning of your life. They walk with you. Once we are done with that in the family, it is the duty of all of us in the community to stop stigma, because this person, once he comes out of the treatment facility, he could be stigmatized. Here in Kenya, in the past few years, mental health was not embraced. But today, I want to appreciate our government. I want to appreciate the mental health professionals. They are really working hard so that this can be adopted and embraced as a mental health condition that can be treated and is manageable. So we prepare the family, the immediate people on the ground, and probably for your information, Dr. Opinde, it's good to mention, could be this problem of addiction originated, the genesis is in the family. So we always take them through this journey so that they can come to realization that they could be the triggers to the problem. Could be this guy is not the problem, but the underlying problems are with the family members. So it is a package. The family therapy is a package. We prepare way before this person leaves treatment. All said and done, there are those who cannot afford the treatment, and we have to prepare them to be accepted in the community. It is a tall order, but it is doable, and we are rehabilitating people, and they are becoming assets in the community.
I am always amazed at the work that you do. I am amazed to see the results that you achieve. Would you please share with our audience how people can access these services that you are offering, especially because I know you work with partners, and
Yes.
Uhai Center has its partners that you collaborate with. Perhaps you can name the different types of partners that you work with.
I would want to mention that I work hand in hand with the body that is NACADA, because they are the ones who had credits. They are the ones who give you the license. First and foremost, I would want to mention that whenever you're looking for this help, don't go to quacks. There are so many people who have commercialized these rehabilitation, this treatment. Beware. Look for people who are accredited. Now, how do I work with the facilities around me? Because I like always employing or running the programs with the existing structures. What do I mean? We have schools, we have churches, we have corporate organizations, we have estates. These are the institutions, the ones that have already been established, that I ride on. I go to a primary school, I go to a secondary school, I go to the university, and I give a talk. I give a lecture. Like I said, I'm a lecturer at Mount Kenya University. After my sessions in management, I take them through like 15 minutes. I volunteer my time to have a talk with them so that I sensitize them. Once you do the sensitization, then that's where you will identify people who need help. That's how you refer them to institutions. So I work very closely with the education institutions. I work very closely with religious institutions. I work very closely with corporate organizations. I work closely also with other non-governmental institutions. We have to join hands. This is an area that you cannot work as a lone ranger. You cannot be in solitary. You cannot achieve anything. So I come to the NGO Whisperer, and the NGO Whisperer passes the message out there that there is one guy in Kenya, Nairobi, called Edwin, and he's doing an awesome job helping people come out of this. So that's why now, even you, Dr. Carolyne Opinde, the founder of NGO Whisperer, you're doing a great job by creating this awareness, such a platform. You're giving this global visibility because it is a global problem. So I work hand in hand with government institutions also. I work with the constituencies. I work with the constituency development funds. I work with government arms, the Ministry of Education, with the local administrators, the area chief, area district commissioner, and they are all aware of the activities that I do, so that they can get help from professionals.
Thank you for sharing with us who you work with. With COVID-19 lockdown in Kenya, how has that impacted your work?
For sure, nothing has been left standing with COVID. This disease has really disrupted all the operations. The systems have been turned upside down. Like, I have not been allowed by the WHO standards and protocols to congregate, to bring people together. I no longer go to schools like I used to do before. I no longer go to churches. Here in Kenya right now, there are some counties that have been locked. There are no church services. There are no congregations. Even funerals and weddings have been reduced just because of trying to contain the menace of brought about by COVID. Therefore, this has really affected my area. My area of operation has really been interfered with. But that shall not and has not stopped me from running the programs. I'm very much visible on social media. Come to LinkedIn, come to social media, come to Facebook, come to programs like the one we are having right now with the NGO Whisperer. I have really, this was an eye opener that you can reach more people even on social media. But there is one thing I want to mention, Dr. Opinde, and to our viewers, that COVID has accelerated the numbers, it has accelerated the rates of alcohol and drug abuse, consumption, use, and abuse. Remember, so many people have lost their jobs. That is depression. And this has brought so many challenges, the economic challenges. And once a human being is hit economically, that automatically affects his or her social life. So you find there are so many domestic challenges, domestic problems. The gender-based violence are on the rise. The domestic violences are on the rise. We have even the violence generally. But all said and done, we are trying our level best. And I really want to appreciate the government of Kenya. They have really embraced the mental health agenda. Previously, employees who had issues with drug abuse, they were sacked, they were sent home. But today, I can see, like the hospital that I'm working in right now, the government is even sponsoring, giving medical leave for them to come to undergo the treatment, because treatment is real. Treatment and recovery is a reality. So in brief, what I would say is that COVID-19 has accelerated the rates, and also the depression cases are on the rise. So it's very important for us to embrace mental health and try to contain the problem.
Our viewers, our audience would like to know, how can they contact you?
Thank you very much, Dr. Opinde. And our viewers, I would want to mention that I have a website, and you can reach me through the website. The website is www.uhaicenter.org. www.uhaicenter.org. You can always also find me on Facebook, Kibe Edwin Gitau. Kibe Edwin Gitau is my name, my account on Facebook, and also Kibe Edwin Gitau on LinkedIn. Kibe Edwin Gitau on LinkedIn, the professional platform. And also, you can reach me through the NGO Whisperer. I am a member of NGO Whisperer, which is doing an outstanding job. I'm really impressed by what you're doing, Dr. Opinde. So through your platform, viewers can as well reach me. Thank you, Dr. Opinde.
Kibe, it's been a great honor and a pleasure to have you. As we come to the end of our show today, what is your parting shot, your last message to governments, to civil society organizations, and good citizens on addiction prevention, rehabilitation, and wellness?
My parting shot is that we embrace mental health. We stop stigma. Let us acknowledge that addiction, let us acknowledge that this is a disease which is manageable. This is a disease that can be contained and also can lead to mental conditions. It can lead to schizophrenia. It can lead to anxiety disorder. So this can disorient your thinking. So whenever you can, wherever you are as an individual, kindly try as much as you can to prevent. Remember, prevention begins with me as an individual. Before you point a finger that so-and-so is not functioning, that so-and-so, the government is not working, this is not doing as it's supposed to be doing, how much input have you provided? How much have you contributed to managing the problem? So it is an individual responsibility. Don't make it available for our children, because as I said from the word go, prevention is the only 100% sure way of managing this problem of alcohol, drug, and substance abuse. So if we make it an individual responsibility, it becomes a collective responsibility. From the African setup where I come from, we say that it takes a village to raise a child. So if you play your rightful role as a responsible parent, as a responsible grown-up, eventually you will take care of the person next to you. And also, as a parting shot, let us embrace Ubuntu. Thank you, Dr. Opinde.
Thank you so much. It's been a great honor and a pleasure to have you here today. Kibe Edwin Gitau, the founder of Uhai Center and a specialist in addiction prevention, rehabilitation, and wellness. We are truly honored to have you here today.
Thank you very much, Dr. Carolyne Opinde, and keep up the good work that you're doing. We really need you. Like today, I feel so motivated. I feel so honored. I feel so privileged that all the way from UK, you are recognizing my little efforts, and I know you're going to support me in all these programs. And I ask you, viewers, to support where there is that positive, there is that noble cause. Keep it up, the NGO Whisperer. Keep it up, and God bless you. And may you live to see the fruits of your work.
Ladies and gentlemen, it's been a great honor and a pleasure to have you join us for part 2 of Addiction Prevention, Rehabilitation, and Wellness with Kibe Edwin Gitau, the founder of Uhai Center in Nairobi, Kenya. We invite you to subscribe to our YouTube channel and follow us on social media. As always, it's all about connecting people, raising funds, and impacting lives globally.